Good afternoon, everyone. I'm Paulette Guajardo, your mayor, the mayor of Corpus Christi. I want to start today with some encouraging information. It has been more than a month since Governor Greg Abbott ended all statewide restrictions and opened Texas 100% related to the coronavirus pandemic. In that time, we have seen cases of COVID-19 drop across the state. The 7-day state average on the day restrictions were lifted was 3,020. On Tuesday, April the 13th, it was 2,456. This is great news for our state and our city. This means that COVID cases are decreasing. Deaths and hospitalizations have also seen steeper drops since March 10th. The 7-day state average of new daily deaths was 187 on March 10th, and it was 64 on this past Tuesday. We're making positive strides in the fight against COVID-19, but it does take all of us working together by being vaccinated and following, of course, COVID-19 health protocols to continue to see these positive changes. That said, we did receive some breaking news that many of you probably heard regarding the Pfizer vaccine today. According to Pfizer's CEO, Albert Bourla, it is likely that a booster shot will be needed within 12 months of the initial 2-shot regimen. This is important to note because both the Pfizer and Moderna vaccines are currently being administered under Emergency Use Authorization, or EUA, and this is why we continue to see evolving guidance on vaccine administration. Now I'd like to discuss the news about the Johnson & Johnson vaccine that emerged earlier this week. On Tuesday, April 13th, the Health District was notified that the Texas Department of State Health Services asked vaccine providers to pause all administration of the Johnson & Johnson vaccine. The pause was recommended following the reports of blood clots in 6 individuals, all women, 6 to 13 days after receiving the Johnson & Johnson vaccine. Right now, these adverse effects appear to be extremely rare. None of the cases of the blood clots reported at this time have occurred in Texas, where more than 500,000 Johnson & Johnson vaccines have been administered. In Oasis County, in Oasis County, 2,353 doses of the Johnson & Johnson vaccine were administered before the pause. So our city-county health district continues to follow CDC guidelines and direction from the Texas Department of State Health Services on vaccine administration. The decisive action by the FDA, the CDC, and the DSHS is very much appreciated, and it tells us that our regulatory agencies are carefully monitoring the vaccine process to protect the public. As updates on the Johnson & Johnson vaccine become available, we will absolutely be providing those to you. So currently, the Health District continues to administer the Moderna and Pfizer vaccines. To date, Texas has administered over 14 million doses of the coronavirus vaccine. Oasis County has administered over 179,000 doses. This said, we still need more community participation. We need you. This is why I'm very proud to announce that the Save Our Seniors Homebound program will be expanding its services. For residents who cannot drive or who do not have a vehicle, we will bring the SOS program to you. So I want to repeat that. For residents who cannot drive or they don't have a vehicle, we are going to expand, effective tomorrow, the SOS program to you. The hotline will open tomorrow, April the 16th at noon, and you can register by calling 1-888-728-0018. I would like to encourage you to use this valuable program to get your vaccine if you are a homebound senior citizen or someone without transportation. As your mayor and along with our council, we are working hard to remove any barriers that might prevent someone from having access to a vaccine. I'm also very proud to tell you about our new vaccine clinic option at the La Palmera Mall. This clinic opened up on Tuesday, this past Tuesday, April 13th, and has already administered over 800 doses, making getting a vaccine more convenient for you. And the La Palmera Vaccine Clinic is located at the old Charming Charlie locations across or catty-cornered from Grimaldi's Pizza. So this 7,000 square foot facility will allow for social distancing so that patrons can receive their free, you can still go to the website and use the pre-registration as an option. You can visit cctexas.com/vaccine registration to pre-register, receive a QR code, and then bring that in. So we are now at the mall during mall hours, which is a huge advantage, because I know that sometimes we can't get away from work. A lunch hour might not be enough, even with the pre-registration. So use this location, as it is very centrally located, to be able to walk in Monday through Saturday from 10 a.m. to 8 p.m. and on Sundays from 11 a.m. to 6 p.m. and be able to get your registration. And I'll also say this, and Annette, you can correct me if I'm wrong, but I had somebody ask if it is required to have an ID, and it is not required. You do not have to show or bring an ID with you in order to get a vaccine. Vaccines are free, no questions asked, just show up or register. So the clinic is ideal, as I said, for extended hours, and for those who may need that, we want to make sure that you have access and you have an extended period of time to do that in terms of hours. Our goal is to provide a vaccine to anyone who wants one. We're expanding access and convenience to ensure that Corpus Christi continues to lead the way on vaccine administration. But we need you. In order to achieve herd immunity, we need as many people as possible who want to be vaccinated to participate. So again, Mall will help you do that. And number two, expanding our SOS program to include those who don't have transportation or need that to receive a vaccine. So there are many reasons to get vaccinated, and I want to go over these quickly, very important. One of them being that fully vaccinated individuals can travel freely in the U.S. People who are fully vaccinated with an FDA-authorized vaccine do not need to quarantine and are less likely to get and spread COVID-19. Each person and each one of us, we have a role to play in our own personal safety and the safety of others. So please get your vaccine. Remember our new location at the mall, which are mall hours. You can literally go in and out in record time. So now I will pause, and we'll have a brief Spanish translation, and then we will hear from our county judge.
Hace más de un mes, el gobernador del estado abrió al estado de Texas al 100% para la reactivación de la economía. De acuerdo a las últimas cifras, los casos positivos por la presencia del virus, muertes y hospitalizaciones también han disminuido. Hoy se dio a conocer por parte de la farmacéutica Pfizer que se deberá obtener una tercera inyección de refuerzo dentro de los 12 meses posteriores a la segunda dosis. En cuanto a la vacuna Janssen, el pasado 13 de abril, el Departamento de Servicios de Salud del Estado de Texas pidió a los proveedores de vacunas que detuvieran toda su administración. Esto debido a reportes de la formación de coágulos de sangre en algunos pacientes. Ninguno de esos ha ocurrido en Texas. En Oasis se han administrado 2.353 dosis. En cuanto se tenga información, el programa SOS para las personas que están confinadas en sus hogares abrirá su línea de registro mañana, el 16 de abril, al mediodía. Usted puede registrarse llamando al 1-888-728-0018. Este programa se va a expandir para quienes no manejan o no cuenten con un vehículo o cualquier otro tipo de transporte. Otro orgullo es la apertura de la clínica en el Centro Comercial La Palmera, el cual abrió el 13 de abril y en donde se han administrado más de 800 dosis. La clínica está situada en la antigua tienda Charming Charlie's. Recuerden, no hace falta registrarse previamente, pero si lo prefiere, puede hacerlo a la dirección www.cctexas.com/vaccine registration y así puede usted agilizar su vacunación. El horario de esta clínica es de lunes a sábado de 10 de la mañana a 8 de la noche y los domingos de 11 de la mañana a 6 de la tarde. No hace falta traer una identificación. Hay muchas razones por las cuales uno debe de vacunarse. Una de ellas es que una persona vacunada con las 2 dosis puede viajar libremente adentro de los Estados Unidos. Todos tenemos una responsabilidad y le pedimos que haga de su parte.
Sorry about that, guys. We're running so fast. The only way I know it's Thursday is I know I'm supposed to be here on Thursday talking to you. The week has just flown by. And good afternoon, everybody. Barbara Canales, Nueces County Judge. And let me give you some good news today. Never really like today, April 15th, because normally this is the day that you have to get your income tax, your federal income tax returns need to be filed. But in March, the federal income tax filing date for individuals for the 2020 tax year was automatically extended from April 15th to May 17th. So we've got until May 17th, 2021. So that's good news, right, for many of us, because it's not just an extension on your filing deadline. It's a deadline on paying any taxes owed. So if individual taxpayers can postpone both federal income tax payments for the 2020 tax year that were due on April 15th, now will be moved to May 17th without penalties and interest, regardless of the amount owed. This postponement applies to individual taxpayers, including individuals who pay self-employment tax. However, even with the new deadline, the IRS does urge taxpayers to consider filing as soon as possible, especially those who owe refunds. Filing electronically with direct deposit is the quickest way to get refunds, and it can help some taxpayers more quickly receive any remaining stimulus payments they may be entitled to. Let me say that again, because this is a COVID-19 briefing, and that's where I was heading, is that some taxpayers will be helped in receiving more efficiently, more quickly, any remaining stimulus payments that they may be entitled to if you get your filing done. So some of you may have had a stimulus payment directly deposited last year, but you didn't get this one for this year, but you may qualify, and that's going to be factored into your federal taxes. But how are you going to find out? You got to do your taxes first. So delaying the federal tax deadline is a big deal. And last year, you might remember that the deadline was extended to July 15th. And this year, it's May 17th. And so I think that example pretty much captures where we are with the COVID-19 pandemic. There is no doubt things are getting better, but we're not fully back to normal yet. I came home from Austin yesterday, and I was looking out. I was not the driver. I was looking out the window, and I saw this amazing billboard. And I've always loved these billboards. They just typically say one word, like courage, or, in this case, it was optimism. And it was a boy in a tunnel with light coming through that tunnel. And he was still in that tunnel, but the light was so beautiful as it was projected on this billboard. And of course, the one word was optimism. Pass it on. And I know that you know, because you watch these COVID briefings, that was the very analogy, the very metaphor that we also used here in Nueces County. We've certainly been in that tunnel when it was very dark, and we've seen when the light started to come through. And now I can see all of the interior of that tunnel because there's so much light, but we are not fully back to normal yet. And so I'm very excited to echo what Mayor Guajardo said about our standing clinic at La Palmera Mall. It's open, it's operating, it's free, it's open late. And while our mega clinics have been such a huge success over time, there is no doubt that the convenience of this standing clinic, walk up, sign up, get your free vaccination, and resume your shopping or your dining, is an option that I know La Palmera is proud of, and I know we're proud of it in City County Health. And so this week, in addition to opening the standing clinics at La Palmera Mall, we've had 3 days of clinics at American Bank and Whataburger and 3 days at Borchard. And today, we had a special clinic called Vax Our Vets at Del Mar's Economic Development Center on Castores Road. Our private providers are also getting the vaccines in their inventory, and you might be able to get yours exactly where you normally get your seasonal flu vaccine, and I'm happy for you, whether that's HEB or CVS. And we're still conducting direct outreach to isolated populations, smaller clinics, bringing vaccine to them. And in many cases, as you already heard, going directly into homes where there's no transportation or there's a disability. So all we need is you. Among all the options that are available, there's going to be an option that is perfect for you, just right for you. Whether that's the mega clinic, a one-day clinic near your home, a standing clinic at La Palmera, or at your local pharmacy. And you've heard about my concern which is when scarcity is gone, it's easy to say that, well, now I can get a vaccine anytime I want to. There's no rush. Isn't it funny how we are as human beings? When we can't find something, we demand that it be given to us immediately, right now. And now that it's everywhere, we say, we'll get to it tomorrow. The time is now. And as I said, all we need is you. So I hope today, this is the day that you say, well, now that I can get a vaccine anytime and almost anywhere, why not today? Why not right now plan your trip tomorrow to one of our clinics? Go to La Palmera Mall. Make getting a vaccination a priority. We're standing by, waiting with a smile to register you. We have the vaccines, and you're not pushing anybody out of line. It's here for all of us. I've said it before, and I'm going to say it again. You are not taking it away from anybody else that needs it more than you. It's your turn. So now that we have these vaccines in quantity where we can be efficient and convenient, people who can deliver them, this is important. We can all be safe together. Please continue to play defense. Do all of the good habits that you've already been accustomed. Keep practicing them. And if you've been waiting to jump out there and play offense, now is your chance. Get vaccinated. It's key to getting us to beat this pandemic and get fully back to normal. I'm thinking right now that little boy in the tunnel, not quite out, with optimism on its right-hand side. And I'm thinking, what will it be like when he's out of that tunnel? And I never thought I'd say this, but it would be great if next year our taxes were on April 15th, because it would mean that we were back to normal. So together, we can help our world, our state, our region, and our backyard get back to normal. And today I brought a message that I really wanted to share with you. Anyone that knows me knows that I like highlighting women's achievements, mainly because it's taken us thousands of years to get some accolades, and it's important to keep telling our little girls at home about these outstanding women. And so I'd like to quote from Marie Curie today. Marie Curie was a great scientist. She won the Nobel Prize twice, and she's one of our greatest female scientists of the 20th century, even though she was born in the 19th century. And this is what she said. She said, "Nothing in life is to be feared. It is only to be understood. Now is the time to understand more so we can fear less." Now, why did I choose that line today? Because I know there are many of you that are worried about the Johnson & Johnson vaccine being paused. I know that you have heard the mayor earlier talk about that third vaccine, or maybe that yearly vaccine that we're going to need, just like the flu. And I don't want you to be fearful about that. I want you to listen to the words of an amazing woman who helped us develop our first X-rays, discovered the very first some radioactive elements called polonium. Annette's nodding her head like, yeah, this is one of our super women. And we're full of super women here in Nueces County, aren't we? So let's repeat it and end with it. Nothing in life is to be feared. It's just to be understood. So we need to understand that we should not be fearful because there is a pause. We just need to understand more. And that's a good thing. And we have plenty of Moderna vaccine. I just was able to tell Director Rodriguez that we're going to have 5,000 more Pfizer vaccines in our community this week and next week. So don't worry, because everything's going to be okay, and we're going to be able to understand more. And when we understand more, we're going to fear less. Thank you, and I look forward to seeing you at one of our clinics this weekend.
El día de hoy es la fecha típica para presentar su declaración de impuestos, pero para este año esa fecha se extendió hasta el 17 de mayo. Así que son buenas noticias para aquellas personas que deben el pago de impuestos sin tener que pagar ninguna multa. Pero si usted va a recibir un reembolso, también hágalo lo más pronto posible. Me da gusto saber de la apertura de la clínica en el Centro Comercial La Palmera. Nuestras megaclínicas han sido exitosas, pero tener esta clínica en el centro comercial es una muy buena opción. Nuestros proveedores también han estado recibiendo más dosis de vacunas en las farmacias locales. Aún así, trabajamos para llevar clínicas a otros lugares. Recuerde, ya contamos con más vacunas. Es importante que haga de la vacunación su prioridad. Le quiero recordar que usted no le está quitando la vacuna a nadie. Existen suficientes para todos. Entre más rápido la mayor parte de la población esté vacunada, podremos llegar a la inmunidad comunal. Le pedimos continúe tomando sus medidas sanitarias y así juntos podremos regresar a la normalidad.
Thank you, Gabby. Annette Rodriguez, Health Director. We're going to start with the COVID-19 statistics. And so to my right, you see the bar graph, and you see the last 2 weeks. So the first week, if you split it right in half, it ends at 4/8/2021. There were 426 cases last week. This week, starting on 4/9/2021 to today, 483 cases this week. So they are increasing from last week for a total of 909 cases of COVID-19 in Oasis County in the last 2 weeks. If you look at the circle diagram, the pie diagram, you basically see that 38,870 individuals have recovered from COVID-19, which is really great news. But you see that we still have over 1,000 active cases of COVID-19 here. Those active cases can easily spread it to others if they are asymptomatic and they feel like they don't need to stay home, they can go out and get groceries. That is what the problem is, and that's how you can continue to spread COVID-19. So we really ask that you pay attention to staying home, give it that time, completely recover, so that way you don't spread this virus to others. The total of the numbers together is a combined 40,689 COVID-19 cases in Oasis County since March of last year. The hospitalizations, if you look at it, it kind of looks like it's kind of gone up, kind of gone down. But if you look at the last few days, so 43, 49, 51, 52, you see like a slight increase. These are people that are in the hospital because they have COVID-19 and they need to be hospitalized because they can't recover at home on their own. So again, those numbers continue to stay high, and so we're not out of the woods yet. These are individuals in the ICU, and you see on the far right, 13, 14, 15, 16, 17. Then it kind of dips a little, but if you look, it's going 15, 13, 13, 15. These are people that need more care than just the average care that you get in the hospital. They're actually an intensive care unit. Some of these individuals are on ventilators, and some of these individuals will die from COVID-19. This next slide is cumulative deaths in Oasis County. This number will always go up because it's accumulation of deaths over time. We're at 762 cases of people that have actually passed away from COVID-19 in this past year. We had no deaths today. And the last graph shows the last 2 weeks of fatalities, and last week, 246, 6 cases last week with some zeros, which is really good. No deaths on those days. And then this week, 7 deaths from COVID-19, so a slight increase. Again, we're paying very close attention to these numbers, and so make sure that you continue to wear your mask, protect yourself, and don't congregate in large settings. So the health district, as the judge and the mayor both said, continues to distribute vaccine, working as hard and fast as possible to help protect and safeguard lives in our county. As such, and as mentioned, we have opened a clinic at La Palmera Mall. The hours are the mall hours, but it's been a little confusing because the hours have changed with COVID-19. At this time, the mall hours are currently 10 a.m. to 8 p.m. Monday through Saturday, and 11 a.m. to 6 p.m. on Sundays. We have both the Moderna and Pfizer vaccines available. It's very convenient, so we hope you'll stop by. Also, during the grand opening, we have T-shirts that were donated by David Loeb. Thank you very much for that donation. Everybody has really appreciated the shirts, and so people are stopping by, and we're happy to say that the first day we had over 500 people that came through, and yesterday we had over 400 people that came through. So we're hoping for a really strong weekend. Now, to shift to what we're seeing as far as cases. We continue to see cases, as I mentioned, going up and down, but we've had 2 days this past week, and y'all all saw it, that one was in the triple digits and one was very close to being 100 cases in one day. These numbers are extremely concerning, while noting the trends we're seeing in our northern states. We continue to vaccinate with a sense of urgency, and we're hopeful that each of you will do your part and come in and get vaccinated as soon as possible to help avoid another wave of cases as they are experiencing up north. Variants continue to exist in our community and across the United States. We expect to see these numbers of variants increase here locally as people continue to make travel plans. We heard today that Pfizer developed their booster shot that is aimed at protecting against future variants. This is very good news. We're also hearing that Moderna is currently working on a booster as well to help fight the variants as well. I think it's important to remind people that if this virus is not allowed to spread, it will never mutate. That in itself is a win to us. So if we were all vaccinated and protected against COVID-19, we could keep these variants at bay. We know and we understand, probably better than anybody, that everyone is tired of COVID-19. We have been in this pandemic for over a year now, but don't let your guard down just yet. And please, whatever you do, keep an eye on your children. With swine flu, the first wave affected adults, and then later affected children, and we even had a death. This makes perfect sense with COVID-19, since there are still no vaccines to protect those younger than 16 years of age from COVID. Please remind your children to wear their mask, to wash their hands often, so that they can be as safe as possible. You may feel a false sense of protection for your children since you are fully vaccinated, but your children are completely vulnerable to this virus. I saw an additional 2 hospitalizations this past week in our pediatric population related to COVID-19. We continue to leave our online registration open at cctexas.com/vaccine registration and encourage you to go online and bring your QR code when you come to visit us at the mall. It makes the process just that much faster. If you have an adverse reaction after receiving a COVID-19 vaccine, please report it to CDC. They do have a website. It's a vaccine adverse event reporting system, and it's here on the slide. It's VAERS, which stands for Vaccine Adverse Event Reporting System.hhs.gov. Or you can call us at the health district and we can report it for you. This is so important as we learn more about COVID-19 every day. Now, I will tell you, some people think, well, my arm got a little swollen, I should report it. That's not considered an adverse reaction. An adverse reaction is something that actually affects you and could send you to the hospital. So, or if you break out in hives, or if you start having that shortness of breath or wheezing within a couple of hours of getting vaccinated, that's an adverse reaction. But please, if you're not sure, call us, and again, we'll help you report it to CDC, or you can self-report online. I also wanted to mention that there's another vaccination clinic at the city's Joe Garza Recreation Center. They have Moderna there, so like the judge said, if it's convenient, if you're located or you live close to it and you're by the recreation center, please stop by. They have Moderna vaccine and they're willing to vaccinate you free of charge as well. So stay well, get vaccinated as soon as possible, and as always, stay informed. Thank you.
En las últimas 24 horas se han reportado 28 casos confirmados por el coronavirus. En las últimas 2 semanas han sido 909 esos casos. Desde que se comenzaron a tomar el número de cifras, desde el mes de marzo del año pasado han sido 40.689 casos por el coronavirus. El día de hoy, afortunadamente, no se reporta ningún fallecimiento, aunque a la fecha los fallecimientos totalizan 762 personas. El Distrito de Salud continúa distribuyendo vacunas ahora en el Centro Comercial La Palmera. El horario de servicio es de 10 de la mañana a 8 de la noche de lunes a sábado y de 11 de la mañana a 6 de la tarde los domingos. Tenemos disponibles las vacunas Moderna y Pfizer. Tan solo ayer tuvimos a 400 personas en esa clínica. Ahora seguimos viendo casos que suben y bajan, pero esta semana hemos tenido un día, casi 2 días, en el que volvimos a los 3 dígitos, en 120 y 98 en otro. Estas cifras son preocupantes. Continuamos vacunando con un sentido de urgencia y esperando que cada uno de ustedes haga su parte y se vacune lo antes posible para ayudar a evitar otra ola de casos que se están experimentando en el norte del país. Las variantes continúan. Esperamos ver que esa cantidad de variantes aumente aquí a nivel local a medida que las personas continúen haciendo planes de viaje. Pfizer ha desarrollado su inyección de refuerzo que tiene como objetivo proteger contra futuras variantes. Moderna está trabajando en otra vacuna de refuerzo que ayudará en nuestra lucha contra estas variantes. Le pedimos no baje la guardia y vigile a sus hijos, ya que todavía no existen vacunas para proteger a los menores de 16 años. Por favor, recuerde a sus hijos que usen su cubrebocas, que se laven las manos con frecuencia y que las mantengan lo más seguras posible. Seguimos dejando abierto nuestro registro en línea a la dirección www.cctexas.com/vaccine registration y lo alentamos a que se conecte y traiga su código QR al centro comercial, hace así el proceso mucho más rápido. Si usted presenta una reacción a la vacuna, se le pide que reporte. Para poder hacerlo, puede hacerlo llamando al 826-7200 o en línea. También puede hacerlo o no, llamándonos, nosotros podemos ayudarlo a reportar esa reacción. Una reacción es una que puede enviarlo al hospital. El Centro de Recreación Joe Garza también cuenta con una clínica de vacunación para aquellas personas que se encuentran en esa área. Le recordamos que todas las vacunas son libres de costo.
Thank you, Gabby. Thank you all for joining us this evening for our press conference, and we'll see you next Thursday for the COVID-19 presser. Thank you.